From law enforcement, from health officials, and even parents, we've heard the tragic stories surrounding the deadly increase of fentanyl in our area.
Well, now the state, along with Multnomah County and City of Portland, are declaring a 90-day fentanyl emergency and coming together to create a command center for all of the resources available. Fox 12's Drew Marine joins us live after attending that press conference. So, Drew, what can Portlanders expect over the next 90 days?
Multnomah County Chair Jessica Vega Pederson says one of their main goals is to increase visibility of outreach workers interacting with fentanyl users, efforts that Mayor Wheeler hopes will eventually become more consistent and community-wide. This 90-day emergency declaration is another major step in trying to tackle the fentanyl crisis in downtown Portland, but Mayor Ted Wheeler says it's not the end-all, be-all.
Obviously, in 90 days, we're not going to solve the fentanyl crisis in Portland. It is going to be with us for years.
Wheeler, along with Governor Tina Kotek and Multnomah County Chair Jessica Vega Pederson, are working together to organize existing resources at every level through a command center set up in downtown Portland.
We know that despite past action, we've seen fatal opioid-related overdoses increase fivefold from 2018 to 2022, including a record high 209 people in the county dying from overdoses involving fentanyl in 2022.
Over the next 3 months, the command center, managed by an incident commander from each jurisdiction, will report data on the impacts of fentanyl downtown and figure out how they can address gaps in services like treatment. Pederson says there's a 42% gap in substance use disorder services, but Kotek says there's no plan to create more treatment beds in the next 90 days.
Currently at the Oregon Health Authority, we are in the process of analyzing the gaps in needed services across the state, not just in the region. And over the next couple of weeks, we'll be seeing the results of those, and there'll be a clear plan of how we organize current resources to get more beds online, also dealing with workforce issues, and what is the longer-term solution regionally to make sure we have capacity for treatment around the state.
Wheeler also hopes with state and county help, the city can use their 90-day reset model previously seen in Old Town and on the Central East Side and apply it across Portland.
We have to be consistent, we have to be community-wide, and we have to be permanent in our focus. And this will really help us, I think, sharpen the approaches that we need to be successful.
Kotek says right now they're using existing funds, but there could be a need for more later. She says there will also be continued missions between the Portland Police Bureau and Oregon State Police to hold people accountable for selling fentanyl. Live in downtown Portland, Drew Marine, Fox 12 Oregon.